Welcome, everyone. I'm Scott Allen. I'm the CEO for the Family Medicine Education Consortium. And welcome to our second learning session for our FMEC Learning Collaborative around the Bring Your Brave campaign and narrative medicine and hereditary breast cancer. We're super excited to be joined by all of you again tonight after what I thought was a great session last month. And I'm looking forward to some even more stimulating discussion, hearing your reactions about the program, about how you might use it, what kind of barriers you might have. I think we're going to have a really good session tonight. So just some housekeeping and introductory remarks. First, you feel free to use the chat to ask questions, make comments, chime in if you agree with something. That is always an option. But again, tonight we are going to have an interactive session. So you should feel free to unmute yourself, turn your camera on, raise your hand, and we will all participate as much as people can. I think everybody knows how Zoom works, so hopefully this will be smooth. Just a reminder, we are in the second of 5 learning sessions. The next 3 are on the screen as well in April, May, and June. So after tonight, we're going to talk more at the next session about how you might want to integrate training on some of these topics we're looking at and some of the things you're learning that you want to learn about into your residency training, and then talking about how to use the tools in patient care. And lastly, about connecting to the community and making sure your patients and your program itself have good resources out in the community to help with breast cancer, hereditary cancers, support groups, things like that. I just want to make a comment. We are, kind of building this as we go. So there isn't a specific intervention we will be asking you to test in your program or in your clinic. But I know some of you already have ideas for how you might do that. And that's really exciting to us. We want to hear your ideas and we want you to plan whether you can carry it out during the course of this collaborative or not. Plan how you might add to your training program, add to your clinic rotations, how you might integrate some of these strategies. That's really the goal of this work. And just a quick comment, we are not planning a follow-up session after June because we know how difficult it would be late summer to do that, but we are hoping to continue the discussion. For instance, we will have a presentation around this program at our annual meeting in October in Providence, Rhode Island. We have also submitted a proposal to the STFM Quality Improvement Conference, so probably some opportunities in the fall to keep the discussion going. Tonight, I'm doing a brief welcome. I'm going to turn it over to Philip Day, who's going to talk about some of the data we collected from you before the intervention about your comfort with narrative medicine and genetic screening referrals. Rebecca is going to talk a little bit about what you've done since the last learning session. And then Dr. Conti is going to lead a discussion to kind of continue to solicit your input on the materials, challenges you might encounter, things you want to learn more about to be comfortably able to bring these issues up with patients. And then we're going to wrap up with what we want you to do between this session and the next session. Just a reminder, we got 10 participating residencies, 33 participants total, 12 faculty and 21 residencies. And there's over 180 residents at the programs you all are training at. So we're really looking at this as something we hope will spread and you can help us teach your colleagues in your program. So tonight's speakers are on the screen and you can see their faces as well on your Zoom. So with that, I am going to stop talking and turn it over to Dr. Day.
Thanks, Scott. And Philip is fine for everyone for posterity. Let's see. So good evening, everybody. We're essentially for the next, oh, wow. All right. Wasn't expecting to see myself so hard that quickly. So for the next 15 to 20 minutes, we're essentially just going to look at your survey responses from the last session, after the last session, and want to get more information from you, right? So what we received, and you'll see the data, don't really get at the why or the how or what should we do next or what does this mean. So we're going to be talking a little bit more about, or I'm going to be asking you to shed a little bit more light and to give us a little bit more information on some of these responses. So, excuse me, I'm going to share. Like I said, there's a couple of pie charts, or actually I only have 5 slides, so don't worry about it. But most of this is just going to be to spur discussion. And so this was the first question that we asked y'all, and we had 24 responses. Unclear, how many of y'all that are present tonight responded and are represented here, but we still want to sort of get some information from you about your responses to these questions so they can better help us design our project going forward and some of the strategies that we recommend. So the first one is about narrative medicine. And we asked you, what kind of formal training or how much to quantify it in that way that you've received. And so as you can see here, the majority was none, right? So 70%. So that's pretty obvious, right? What that means underlying that, right? So that's zero, no training. But in terms of basic and moderate, we were really interested to hear what that means, what kinds of trainings you have received, and how you would classify that as basic and what that entails, and moderate is what that entails. And as you can see, no one answered extensive. So right now, I'm gonna leave that up. Well, actually, let me leave it up because you know how you responded. So I'm gonna keep going back and forth. Apologies for the back and forth here, but I find that it's easier to encourage discussion in this kind of way. Plus, then I'm not just looking at a giant picture of my own face. So what kind of training have you guys had in narrative medicine, and how would you classify it? If you didn't respond, if you want one of the responses that was captured in that data, then please just feel free to tell us now. Yes, Kimberly.
Yes, I was someone that did not have any prior experience with this and no training in it. And I think, it's such an exciting thing to learn about, especially from others that have experience or energy kind of around that, to see what it can bring to medicine. So, but yes, I did not have training.
All right. Well, thank you for letting us know that. Is it Manasi?
Yep, Manasi. Yeah, so
Manasi?
I also didn't have any kind of training in narrative medicine, and these sessions have been really informative for me, and I think I can really help my patients with the kind of experience that I'm getting.
All right, fantastic. Thank you. Priya?
Yeah, I was gonna say, like, I haven't actually had any exposure to narrative medicine either. But actually, when you hear like patients like share their own stories, like, and when patients are also exposed to other people's experiences, I think it makes it so personal to kind of ask like what kind of struggles people go through, and it really is a very effective way to convey the information that we want them to hear or understand. So I think that's it's a very strong form of like awareness for patients.
Yeah, thank you. I agree with you. And I mean, I think in a lot of ways, we're not, and I tried to capture this very quickly in our last session, we're not just walking around bundles of facts, right? We're a story that we tell ourselves, that we tell to other folks. And so I think that, one, as you say, does put that sort of personal touch, or it's just personal. It's not even a touch, it is personal at its essence, to knowing more about the patient, but it also is more, I would say, of a natural way of sharing information about yourself and about your experiences than I am 37 and I live in Worcester, Massachusetts, and that kind of thing, right? So thank you. Who else? So is anybody on the call tonight who said that they had some basic or moderate training?
I went to med
Emily,
school
yeah.
at Penn State College of Medicine in Hershey, Pennsylvania, and they have like pillars of their curriculum, and one of the pillars is humanities. And so like we have a pretty robust each year of medical school, you do like different aspects of this humanities curriculum, and in the first 2 years it consists of like watching there's medical staff that put on like skits of patient stories for the class, and there's sessions where are open to like your own class to play music that they've written or read poems that they've written about their experience, and you like listen to your attendings like play a piano song or read stuff that they've written. And so kind of like highlighting that theme of creativity and reflection in medicine, which I think is a piece of narrative medicine. And then we also have had sessions that were where you would have patients who have a particular disease or diagnosis, and they would come and kind of talk through their experience, and they would have their doctor come and also talk through the experience together in front of our whole class. And then we would engage with them in discussion. And then we've also had experiences regarding insurance. And so we had patients, like a panel of different patients, and they would talk about their experience like interacting with their like the medical system and through insurance. And I think like all that there's kind of like this thread of narrative medicine kind of through that.
Yeah, that's great. And so I don't know how you classified your response. It sounds like pretty moderate, right? Maybe even moving into to a higher realm there. And so for the sake of, thank you for that, Emily. So we'll be calling on you as our expert tonight for narrative medicine. Thank you. Jenna, yeah, I see your hands raised. Would you like to tell us about
Hi,
your training?
sorry, my camera isn't working tonight. But I, similar to Emily, had some exposure to narrative medicine in medical school. I went to University of Vermont, and they do a lot of integration of patient stories. Our first few exposures to patients are actually just like interviewing them about their social history. We have kind of professionalism groups that actually every year we picked a book that was non-medicine related, and it was basically book club, but with your medical peers, and like analyzing Animal Farm and other kind of classic literary pieces. We also did story slams, which was by healthcare providers writing stories about what they've seen, what they've been through, as a way to like help with resilience and decrease burnout. So there was definitely, it was a very, I'd say, consistent longitudinal exposure to narrative medicine, but wasn't necessarily called that. And we weren't taught it in like a concrete way. But the emphasis on narrative and trying to find a way to integrate it, is particularly into primary care, which is a big focus of UVM, was really kind of sewn into all the teaching topics.
Awesome. Great. Thank you. Thank you very much, Jenna. Anyone else want to weigh in on any trainings that they have had in narrative medicine to any degree, whether it's formal or threaded or just sort of something that you've realized after the fact, before we move on? All right. So next question, if y'all see my screen again. So we'll go to the next one. So the next few have to do with comfort, right? How comfortable are you discussing hereditary cancer risk assessment options with patients, discussing genetic testing options, and then these two are about comfort. So when we look at the responses, sorry, I got to get rid of my face there. When we look at the responses, we have a large sort of neutral, right? So how do you, not really sure, to uncomfortable and comfortable about split right here on this one. And then when we look at genetic testing options, again, sort of a large pie, large slice is neutral, and then we have uncomfortable to comfortable, right? But mostly uncomfortable and neutral here. So again, this has to do with discussing hereditary cancer risk assessments and genetic testing options. And so let's start with this one. And I want to see sort of, since we have such a large proportion is uncomfortable to neutral, we really want to know, what makes the discussions uncomfortable? Sorry, I'm going to keep doing that. I apologize for any kind of digital whiplash there. To what would make it more comfortable. So how would you characterize that? How would you characterize having these types of risk assessment discussions with patients? Or reflecting upon your own response to this question, if you could tell us perhaps what would make it. Juliet?
I think, I mean, in my facility, we generally refer these patients to genetic counselors. So I don't think we have a whole lot of awareness of what goes on after that, other than there's a discussion of risks and benefits of testing. And so I feel like our role is more identifying the patients who may benefit from this testing and going from there.
And how do you find those, even those brief sort of conversations with the patient and then the referral? How does that go? Is that uncomfortable? I mean, how do you feel about saying that you need to see a genetic counselor?
I've been comfortable with it. I've been out of residency for like 7 or 8 years, so I've had these discussions, and we do see I've had just recently, a week or so ago, one of the residents had a young patient who had a very strong family history And our institution recently started an early action breast program. So now it makes it like even easier for us to kind of get them in with all the resources they need as far as when and what to initiate as far as screenings go.
Great. And the final question I'll ask you directly, Julietta, that jumped ahead a little bit, but is the presence of the genetic counselors, is that something that facilitates or makes that an easier, more comfortable? I don't know if comfort is the right word here, but does having that sort of chain of referral to robust resources, does that make it easier or facilitate the process?
I think so, because I'm not doing an analysis of the family history. I'm not, I don't know the exact numbers, but they can certainly provide more insight as far as that goes in risks and benefits.
Good. What else? How, and so again, the question is, discussing hereditary cancer risk assessment options with patients. Do you all do this regularly, or is the general experience that you have you have some kind of other process for sending or referring patients away?
I would say, at least for myself, like I'm a second year resident right now. So we're still, like learning on when to kind of pick up on those things. So I think the sessions were really informative to see like what kind of things to look out for from the physician side when a patient gives you their history, or what kind of things to ask for like a young patient, and when to kind of screen those situations and what to do next. Because our patients, especially, like they are looking to you to be like the expert of to like answer their questions, especially if there is something like that and they're not aware of it. So I think it was informative for me to also be like, oh yeah, so this is something that we definitely want to include in our wellness sessions, especially for like young patients, to ask about these things and to see if they have so-and-so risk factors, and to actually bring it up, because if the patient doesn't know that it's important for us to know that information, it might just get missed. So I think that was really helpful. And so that definitely is going to help me pick up more cases in the future. So that being said, like I think that was like helpful for me in that aspect, that's not something that I was doing previously.
Yeah, I think that, and hopefully, sort of the purpose or one of the purposes of this campaign is to make it more routine, build it more into your daily practice. So hopefully it does sort of increase that comfort level or make you feel more confident in having these discussions with patients. What about genetic testing? This is something I've done a little bit of work on in terms of some of the ethical sides of this, but also how do you consent folks into this and what does this mean? But what about genetic testing and talking to patients about this? I know things have, whether it's about insurance or a lot of it has to do with insurance, but also the unknown elements that can be found, the fact that some tests are only very specific for some causes or etiologies. So what about genetic testing options? What's your general experience with that? Because again, that one was mostly neutral to comfortable. So if you could please, or share some of your experiences talking to patients, we'd love to hear that.
I think a big challenge with counseling about genetic testing that impacts my comfort is timing. Oftentimes when I'm getting a more thorough family history, it's for a physical or an established care, and there are other things to discuss. And, I think in order for me to discuss genetic counseling, a lot of patients don't have a great background, and it takes a lot of time to thoroughly discuss, the pros and cons of it in a way that's palatable and understandable. So just the timing can be, I think, a big barrier.
Yeah. What else? So let me look at that one more time. Sorry, I can take a glance. So yeah, comfortable 25%, neutral 29%, uncomfortable 40%. So again, this was about discussing genetic testing. So anything that you guys could shed some light on these responses? What would make this uncomfortable, or what would make it more comfortable?
I think I remember answering it uncomfortable. I'm a first year resident,
Megan.
so I don't have a lot of experience yet. So I think a lot of like the comfort level will come with more experience, like talking to patients and just learning more about the area, and like if we have genetic counselors. and just learning more about the tests. I think a lot of the uncomfortableness just comes from not knowing.
Not knowing.
So
yeah. Experience and knowledge will come. And is it? And I'm not sure. Is it Menachem? Menachem? How do you say your name?
Yeah, right. So yeah, Menachem.
Menachem, awesome. Thank you. So could you please give us some little insight into your experience with counseling patients about genetic testing?
Yeah, as well. I think some of this lack of familiarity of how to do a thorough counseling, honestly, and for patients where I feel like the handful of times where it's come up in discussion with me, I refer patients to a genetic counselor and it's not covered. And my patient population I deal with is largely underserved or underinsured largely. And it's just lack of resources, lack of really education on my part as well. Just being comfortable with just giving a deep dive into a conversation of like, this is what this means and what are the next steps. I feel like that's the roadblock I kind of run into.
Yeah, good. So experience, knowledge. Thank you for sharing. Making it more routine, making it Suganya. Is that how you? I'm sorry. Is that how you say your name?
Yep. Suganya.
Right, awesome.
I work with Priya and Megan, and I think I just graduated and I'm a new attending. And I think for me is the lack of having a script to have that interaction. So that if there's a moment where I don't know what I should be doing, at least there's a script that I could refer to. And we're in an area where even if we refer, it takes forever and our patients can't get there or there's barriers. So it's also like, what are my alternative options? And it's also like education on my part too, that I think where I pick the neutral as my answer.
Good, great. Anyone else want to share before we move on to the last question regarding results? Have y'all had to talk to your patients about the results of their genetic testing? I know that is also something that's also done by the genetic counselors. So that would explain, here, I'll say this one real quick, while a lot of that was very uncomfortable. As you can see, this is the response rate here. We have very significant amount of uncomfortable, very uncomfortable, neutral, right? Only 12% answered in a positive direction. So
I think like another aspect that I'd say would kind of make me like as a resident like uncomfortable would be if they have like specific questions regarding like statistics or to say like to talk more about their risk. Like it's not our area of, at least it's not my area of expertise to be like very up to date on that information and to constantly be up to date on that. So I think that would be a little bit difficult for me to say like off the bat if I saw them in clinic until I actually did some research on it or had a chance to either talk to the genetic counselor prior to seeing them in the office, then I would have a little bit more information. So I think maybe having like these conversations just to kind of stay updated, I think would also be really important, just to know like how like what you would need to counsel them on and what kind of conversations you would need to go over.
Great, thanks. And I have a question, but I'll ask it in a sec because I want to elicit some any more responses related to, again, discussing the outcomes, right, of genetic testing with patients. Do y'all routinely, so this is just a question, it's not part of that, it's I teach in residency as well, and I'm part of residency education, so I'm just curious, do y'all, any of y'all, just by show of a hand or whatever, have any kind of education from genetic counselors as part of your residency, either as a resident or as a faculty? Yeah, we didn't when I was at UT, and I don't think so here at UMass either. So that's really interesting. That's something to think about in terms of like perhaps addressing some of these knowledge deficits, some script issues, as was said. What do I do? Numeracy. I mean, that's something that's difficult. I know with a lot of Americans, and as well as health literacy. So thank you very much. That's the last. We sort of covered the frequency. Tracy, did you want to add something?
Yeah. Sorry, I was having difficulty raising my hand. I'm on my iPad. Sorry. So, we are one of the few departments at University of Pittsburgh that does have a primary care genomics trained family physician, and so have what's called the primary care PCPM, patient-centered precision medicine, right? And so it's a group. I can tell you that prior to that, all of our genetic counseling was done externally. And it wasn't until the development of this program in family medicine in training and residency that people became more comfortable even referring and understanding genetics. So I think that is something that to think about in the future if we really want this to be done in primary care, establishing primary care genomics within family medicine training.
Yeah, that's really interesting, and thinking about what the basic competencies could be, right? What a standard, at least foundational curriculum could look like. So I about a minute or two overtime, so we're gonna stop there. Thank you again very much for participating and answering these questions. It gives a little more insight into what your responses mean. And again, thank you very much for sharing your experiences. Rebecca, I think it's back to you.
It is. Thank you. Thank you for that. And I've learned from my experience that I'm not going to spotlight myself. So because I don't want to jump right out there at everybody. I am going to share my screen though. I'm just going to take you through really quickly some of the results that we got from the activity 1, the learning session 1 action period activities and the survey results that came in from the pre-survey. I'm going to preface this with not everybody has sent in these results. So if you haven't sent in your responses, please still do so. Even though we haven't, even though it's learning session 2 now, the more information that we get from you, obviously, the better for this collaborative. So first on our pre-survey, we had one question that said, do you see yourself being able to use the Bring the Brave materials with patients? Only one participant answered no. And that's because 95% of their patients only speak Spanish. And the Bring Your Brave site only has English speaking videos on it currently. So that's really important to know. That's some great feedback. And as we move into barriers for using Bring Your Brave materials in the next activity, that's the sort of responses that we're looking to hear from you. Most of the parts, everybody else said yes. Some of the quotes that came out of it were, patients tend to use technology and are eager to have resources where they could go find things themselves. So that's good. And it's a great resource for patients to learn more and to find stories that relate to them. One of the other comments that was there, even though it was a positive answer, was it's great information to be shared, but this participant was not sure if people would take advantage of the research if you didn't have time to go through it with them. So that being said, they are sure, they're not sure that they would have time in clinic to do it. So that's also important for us to know. The other two questions that were on the pre-survey this time would you recommend using would you recommend specific Bring Your Brave videos to patients? The results were high on the very likely end of the scale, and the same with the Bring Your Brave website, recommending that to patients. So those are good responses for us. As a reminder, we had 3 activities for the last action period. The first one was reviewing the Bring Your Brave website and the videos that were on it. The second one was reviewing the StoryCenter, which was a link out from the CDC website. And then the third one was reviewing the Kognito simulator, Let's Talk. So very, very briefly, some of the things that jumped out at me as I'm looking at these responses were 80% of participants in activity 1 said that they would utilize the materials in the future. So those videos that they use, they would use them in the future, either recommending them to patients, colleagues, or both. And 97% of participants said yes when they responded to the question, did you learn anything new, or did this change your perspective at all? And that was responses to the particular videos that everybody was watching, to the specific videos. Some of the comments that came out, I'm not going to read all of these to you. And these are by no means all of the comments that came back. These are just a few that I've pulled out. The first one talks about this participant was struck by this because the video is asking us as clinicians to be sure to ask the next question. That even though somebody says they have no family history on the sheet, it's our job to ask further questions to ensure that's true, especially when many of the patients that they see speak Spanish, and there may be questions that are lost in translation. Another one that this is part of a larger quote The gentleman in the video notes that he didn't tell anyone in his life about his diagnosis due to stigma. In this participant's mind, they imagined that most patients would want to share their diagnosis with loved ones and to be surrounded with thoughts and prayers and emotional support and physical support. So this video changed their perception on the way that some patients could be approaching their diagnosis with friends and family. So that was a really interesting perception and change of perception that came out of that video. Activity 2, what struck me so far with the results is 100% of participants said that they would utilize the materials they reviewed in the future. This website has videos with attached workbook that you could go through with patients, and they said that they would recommend them to patients, colleagues, and both. One of the comments that came out was, this is a good, and I really, this comment struck me. This is a good reminder that we too as clinicians are human and that it's okay to feel emotions for our patients' lives and their circumstances. So it's good to see that these are having that emotional connection in the videos, which is fantastic. Activity 3, which is the simulator. 91% of participants responded that they would utilize the simulator in future. Some of the really quick comments that came out of it was this participant thought it was a helpful exercise to go through. As a physician, we spend a lot of time learning how to have difficult conversations with patients, but I do not always explore how they will tell others unless they ask for advice. So, hereditary risk information was helpful to me, but I wonder if it is a higher level than the general patient population will absorb, which is an important feedback point. And this step-by-step, non-judgmental guide about how to discuss cancer risk with family members can be so helpful. So those are just some of the comments that we're getting through. And Dr. Conti is going to go through now with you and discuss some of your feedback and some of your impressions that you had from the activity. And then as we're talking about this and going through it, I'm going to talk to you a little bit later about the learning session 2 action period activity, which is going to be thinking about using this in clinic with patients and some of the barriers that you might have to doing that, like whether they're knowledge-based or logistics-based, and then coming up with solutions. But there'll be more on that later. So now I will hand this over to Dr. Khan.
Thank you, Rebecca, and thank you for not highlighting me, so I didn't see that frame on my face.
I learned my lesson.
So this has been a really good discussion so far, and I would love to continue that. Part of the residency learning collaborative is really us learning from each other. But with this specific learning collaborative, it is around the Bring Your Brave campaign and some of the tools and resources that you have available to you. And so just wanted to have a conversation to hear some feedback and your impressions about those resources, either ease of use or access or any other thoughts that you may have, because that's how we build a better learning community. And even if there are ways that you have utilized some of those tools already, that would be really helpful. So would love to hear from you all. Well, let's talk about just even I'm going through the videos. I know we talked about a little bit about that in the last learning session. What did people think about the videos that they've seen so far? Have you utilized them for patient education, or have you used them for your own education or even in your residency program?
I haven't used them yet, but I do definitely plan to. And I think what I really liked about the videos was that you definitely, like, watching all the different videos, you get a different aspect from each of those components as to different outcomes, number one. Number two is, like, from like the patient side, it's like, what kind of questions can arise, what happens. And there's another video where the genetic counsel also speaks And then so they talk about like what the BRCA means and what they talk to patients about. So I think kind of seeing that kind of overall experience from like A to Z, like I think was really helpful for me. So then that way I know like when a question does arise, how to approach that and what to do and what's my next step. So I think that was really helpful to kind of help ease some of their like questions and some of the things that might come up when I do have these conversations with patients. So I was really grateful to that those videos really did highlight it. And I think there was even one where a patient was really anxious about getting a phone call regarding like after a biopsy result or like it was positive BRCA test and like how she would go about telling family that. So I think those are very realistic scenarios that we need to be prepared to have with our patients. And I think that was really helpful to kind of see their reaction and kind of join that narrative medicine perspective with that.
Yeah, yeah. So I also hear you bringing in not only the narrative medicine, but the importance of kind of role play in that kind of that see one, do one, teach one, and seeing an example gives you some, you know, pathways to be able to chart your own journey when you're in that space. So good. Thank you for that.
Yeah, I agree. And I feel like I have not yet, but I can definitely see myself referring patients to this page because as I was scrolling through, I think it's a very like approachable, user-friendly website, but also, you know, if I was somebody who was nervous about genetic screening, like I think it's a very easy way to kind of dip your toe in the water and get some information with a couple quick videos without feeling overwhelmed compared to just Google searching it and having whatever come up.
Yeah, no, yeah, thank you. That's helpful. And I'm glad to hear you say that ease of use, because I think that's important from your perspective and the patient's perspective. Especially with health videos, you can Google anything and it's always a risk of what you're going to get. And so if you can find a trusted resource, that's really, really helpful.
And just to add to that, I definitely agree with like the timing of the videos too. They're really quick and short. And so that's really going to help with patients, especially, you know, if they're going to have difficulty understanding or anything like that, it does keep their attention span for that short period of time to get all of the information they need to. So I think the timing of the videos were very well done and they got all the necessary information out in that short period of time.
Priya, I agree. That's something that really stood out to me as well, is that the timing felt really, really good, really easy to go through. And even though they're brief, they really do bring in those different experiences and perspectives that I think will hopefully patients will be able to watch a lot of them to find a story or something that they'll connect with. And so I think it's a very visually appealing website. I think when I was looking for something specific, I didn't find it as intuitive to navigate around the website when I was looking for something specific. You know, I found it easier in the Excel sheet to click into it or to look for it specifically. I think especially from the Bring Your Brave homepage, again, it looks great and the topics are there. Fortunately, I think all of the information is helpful as people would navigate around. They would probably find even more things that they could benefit for. But if they were looking specifically for a certain type of video, I had a little bit of trouble knowing exactly where to click in to find it. I didn't find the headings as intuitive for me.
No, that's really good feedback. And especially, you know, for our patients, if you are guiding them to a specific video, that ease of looking at where they can get that video versus kind of scrolling through the page and finding it.
Agree. Sorry, just to add to that, like, because there is, like, they do name the videos by, like, story of this person, and that's kind of how it goes through. But yeah, I completely agree with Kimberly, is that you kind of had to go through each of the videos to hear different scenarios. And it would be maybe easier to see, like, what the outcome would be for each video right off the bat. So if a patient wanted to scroll to see something, then they would go to those videos first, rather than they may not have the time to go through each of those videos to kind of learn all they want to. So I think that would definitely like make things more user friendly.
I knew some of this videos really kind of name it, you know, somebody's story. One of them I saw, it had kind of a trust name under it. Would that something like that be helpful to talk about, you know, the specific topic that they're talking about? Any other thoughts? Thank you guys so much for your participation so far. This is good.
I think too, my clinic is doing an initiative with hereditary cancer screening kind of right now. And so there's already been like education in our clinic with incorporating this into our workflows. And we found that a big piece of this is actually like also educating the other staff, like our medical assistants and nursing staff on these topics as well, because we've kind of made a workflow where like the MAs kind of help the patients do a screening before the provider even gets in the room. So then we get a message in our box that says, oh, they screened positive for this. And so I think videos like this, because I think anytime someone hears like, oh, we're adding another piece to the 1,000 things you have to do to room this patient before their CPE or other physical, I think they're just like, oh, I can't do another thing. But I think like something like this is really important. And like when you do hear these cases of, oh, like they screened positive for this, and then we did this genetic testing, and you know, there are these cases that really just like show you how important this is. And I think it's uncomfortable now because it's so new to our clinic and our workflow. But I think video like this page can be a resource to send our medical assistants to and our nursing staff to say like, this is why we're doing this as well.
Yeah, thank you, Emily. And it's so important when we think about change. It's not just physician and behavior, it's the whole office. So from the front desk to everybody who's touching that patient, that we need to inform everyone about what we're doing and getting feedback and understanding. So thank you. Other thoughts about the tools that or the resources that you have available through Bring Your Brave?
I just want to make a quick comment that I thought one of the themes that came out for me in terms of your responses since looking at some of the resources was it made you realize sometimes what the patient is saying is not maybe the 100% the truth, or you need to kind of think a little harder about different scenarios and, you know, maybe prod a little deeper than you had been, because you've seen now some examples of patients who maybe didn't take the advice exactly the way you expected them to, or had barriers at home around disclosure or things like that. So just the idea that seeing some of these stories maybe makes you think differently when a patient answers you and you want to prod a little bit more, which might take time, but ultimately get to a better resolution.
Absolutely. Anybody have a specific example of that they'd be willing to share? I feel like Philip, your slides were so engaging. We've utilized all the talking.
Well, I was going to ask if having since responded to those questions and then viewing the resources, if you would rate your comfort levels any higher, having that as, you know, the ability to see these narratives, to hear about these patients, and have a broader understanding of how this kind of screening or risk assessment or genetic testing can be taken by patients. Like, so would you think that having these resources would alter or change how you would respond to some of these questions? Is this the kind of thing that makes this kind of thing more comfortable, I guess? Sorry for using the thing twice in the sentence. Well, hopefully, as we go through this, those comfort levels will continue to rise. I do like seeing these kinds of things, thinking about you know, elements of shared decision making and how you can better help patients articulate their values, what they want. Seeing that in other folks, right, and other people who have similar stories, I think can be a powerful way to, you know, both empower them in their autonomy, but also to give them a broader sense of thinking about their health and their outcomes.
Yeah. So we talked a little bit about, the stories. What about the simulator? Has anybody had experience utilizing the simulator, and any thoughts about that process? And if not you, have you gotten feedback from your colleagues or faculty about the simulator?
So I was hesitant about the simulator at first because I don't love using them for learning. But I think it's nice to have multiple different modalities because everyone learns differently. But what I found most helpful about it was I don't know that I would necessarily recommend a patient use it, but I think me having gone through it, I would better be able to give a patient advice on how to carry out those conversations in the office. So I think in my response, I put I would be more likely to recommend it to a colleague, actually, almost to gain comfort so that we can engage patients in person about it, because it was just more time intensive, that I would be worried that a patient wouldn't, not all my patients would be as invested to take part in it.
So thank you, Jenna. So just a couple of things, if I can follow up. So time, how much time did you feel like it took you, and do you feel like that's a barrier to utilizing that tool?
I think it took me, like, for each case, like anywhere from like 5 to 7 minutes. But I think for me, it's like that, the idea of like, I could have a video on for 7 minutes and it would seem quicker, but like the fact that you have to click, like that mental, like, oh, I'm doing so much right now.
Mm-hmm.
So I could see that being a bit of a barrier myself.
Mm-hmm. Mm-hmm. Thank you. Any other thoughts about the simulator, either from it helped you in talking to patients or being able to understand the needs of patients, or it was really a barrier for you? Any other experiences? Right. What about any of the other tools, even the tools that we have for you? Is that do you have ease of access of getting to the materials? Any difficulty with being able to see some of the recordings that we've done of these learning sessions? So it's great, perfect, and we're all good.
I did the Kognito simulator one with the mom talking to the daughter and the son. I did it on like a desktop computer at work, and it worked like really well there, like having the desktop. I don't know if it translates well to phone. I didn't try it on there. But I know you have to like click a lot of things, so I don't know if that's like easy on phone or if it was hard.
Has anybody tried it on the phone?
I haven't, but I know I was having trouble accessing it with Google Chrome. It was telling me I needed a different browser or something.
Did anybody else have experience or difficulty based on the browser that you were using?
Sorry, that was the Kognito simulation, not the other stuff.
Okay.
For me, like the videos, like it would just go on to like the YouTube site where it was uploaded. And then but I didn't have any difficulty with it. But in case, like, like they may have some barriers on that if like not all like web browsers would do that versus just opening the video right there.
Mm-hmm. Mm-hmm. Any other thoughts about the tools, or even, the learning sessions so far, and how this experience has been?
I think the learning sessions have been helpful and kind of, opening my eyes to some things that we might be able to do better at in the future, and being aware of the tools. When I did explore the campaign website, I personally found it a bit overwhelming with the volume of material. So I'm not really sure if I would use that for, I guess it just depends on the patient and my perception of, if they're tech savvy, if it's something, that I think they would, I think it's not for everyone, that's for sure. But I was just like, do I watch all of them because they're all so different, or do I see a few of them? And it's, it is time consuming to watch all of them for sure.
And I definitely agree with Juliana that there's also like different links that we had to click to go through like the different screening the questions. Like, I mean, it is a lot of the information was repetitive, but at the same time, it was also just a different aspect to see it in. So I think that was also definitely like it did take some time to kind of go through and click all of that. So I would just say like with some of my more patients who are more non-compliant, or even the literacy, maybe a question, I think that would be a little bit difficult for them to go through. So in that sense, unless they directly jump to the videos, they may not go through all the reading and to go through all the next steps to click, oh, what about this step and what about this step? So they might get overwhelmed in that area.
Thank you for that feedback. Did most people read the material first and then, watch the stories, or did you find that you just dove into stories and then would supplement with some of the reading?
I did both for myself, just because if I do something that I just like to do all of it, so then do it. But it did like they did a pretty good job at like putting in all the information that was in the video in the writing as well, like right beside the patient's story. So that was helpful. It's just yeah, like unless you click through each of them, you don't actually see that. So that's kind of the subheading part that we were talking about. But yeah, like until you actually read through it, like you kind of may miss some information if you don't do that.
And Juliana, it looks like you were going to say something.
Okay, I totally thought that was just a transcription of the video, so I didn't even look at the reading. So was there different information in there?
It's very similar, but a little bit different. So maybe perhaps explaining that more, having some verbiage around that can be helpful. Any other thoughts about the resources or the tools on the Bring Your Brave campaign?
I just want to say thanks. This input is really, really helpful for us in thinking about how these tools, these materials, and these learnings could roll out in a broader sense. So I've heard a lot of things tonight about, even going back to the beginning discussion around narrative medicine, and how some of you felt like it's helpful to hear from doctors who are actually kind of practicing it and experts in it to kind of motivate you to learn more. We clearly have heard tonight about the need for kind of genetic counselors maybe to do some cross training with family physicians about what they're doing with patients, how they're talking to patients. And some of you have those resources, some of you don't. So to make this program work across different types of settings, we probably need to think about genetic counselors and testing and education, what that means. And then just the idea of it's not just a physician or delivered service. It could be something that a whole practice team or clinic team learns about, and maybe there's going to be people on staff who really have a personal connection or get more familiar with the tools. So all of those things, I think, will lead to adopt it. And clearly from the survey results, we heard that these are useful tools, but we want to make sure they get used, and how do they get used, and how do we teach up and coming students and residents about them. So this is all feeding into some really great ideas, I think, that we can work with you on and do in the future. So thank you. Go ahead.
Sorry. I think having like a physical pamphlet with maybe some pictures and the reference to the website and would be really helpful, because I mean, I like to give my patients something that they're not going to forget about, because if I just say, oh, go to this website and look at the videos, I don't think that's going to be, I think it needs a little more guidance and something physical that they can take home so they don't forget about it.
That's really great. Thank you. Thank you. We'll keep, and if you guys think of other things after this session, please, email Rebecca, and we'd be glad to hear that, because this really is about how do we ensure that this information is working for you to be able to deliver to your patients, and that your patients can understand it in a way that will help them guide their health. So thanks.
I was also thinking, like, because I know like we did get like the workbook, and that's that's definitely something like that we can give to our patients, but at the same time it is 27 pages, and it's hard for like a physician to like go through unless they've gone through that before. It's not something that's like really quick to glance at it and go through really quickly just to get all the information you need to know to have this discussion. So this requires work for us to do behind the scenes to already be educated in this prior to having this conversation, because it's not something that you can do like really quickly or look up. And so I think like a pamphlet would be like a really good way to kind of go through like a really all of those highlighted points and go through that really quickly. So because as you can, like, we're going to have those situations, and unless we're going to be experienced in this, it's not something that's I think will get missed. So I think that would make it for more ease of use.
Well, thank you. Keep them coming. Keep them coming. I'm going to ask Rebecca to share the screen so we can just talk. I want to make sure that we end for you guys on time, and we don't extend this session. We appreciate your time. And so our next action period. And so what we really want you to do is think about, using these materials with your patients, and try to really identify what are those barriers. And I know that you have talked about some of those, but also what are those potential solutions? I appreciate that pamphlet, because I think that is something that can be a real solution. So this is, you don't have to document anything. You don't have to like write a report, but really want you to talk to your colleagues and identify what issues are limiting in utilizing these materials. And then once you've done that, think about, okay, what would be the potential solutions? And so while we're not asking you to give a written report, we do want you to just choose one representative from your program that can have an interview with Rebecca. The dates that she'll schedule these interviews are between April 1st and April 11th, to give you some time to meet with your teams, to identify these barriers, to brainstorm solutions. And then, she's going to have a structured, interview with you to talk about what some of those things are. Next slide. So watch for the emails from Rebecca. If you guys have discussion, remember we have this group email now, and it's up and running, and it will, if you utilize this in your email, it will send to the whole group so you can get some response. Those interview sessions will be held between April 1st and April 11th. So as you are having those discussions with your team and you're choosing that rep, make sure that you choose someone that's available during those dates. Just some future things. Learning session 3 will be in April 13th, and then May 17th and June 27th will be the last ones. As Scott alluded to earlier, we won't have a wrap-up session, but there will be opportunities for discussion at some other conferences. So the fall FMEC conference, as well as potentially the STFM. It's the improving practice.
QI, practice and QI.
Yeah, practice.
Yeah. All right. Again, any questions, don't hesitate to contact Rebecca. And it's 8 o'clock. So thank you guys so much. Any questions before you guys go?
Thank you.
Thank you, everybody.
All right. Thank
you.
you.
Thank you,
Thanks,
everyone.
all.